think maybe more specifically, what can be done to streamline the conversion to the new healthcare model. Someone had a question about maybe tying that into the hospital and clinic here. So again, we have lots of interest in that. So I wanted to turn that over to you guys.
Well, let me start by saying that the Peter Lougheed vision of how our province should work is that he didn't think you should just have to be able to live in Calgary and Edmonton to get the services. It's why he built hospitals everywhere. It's why he built runways everywhere. It's why he understood that if you're going to attract families to a community, you need to have a good local school. And if you want to attract the parents and grandparents, you need to have the good local health care and the long-term care facilities so that everybody is able to be here as a community. And you have to have easy access to be able to fly in, fly out. I think we kind of lost that vision over the last number of years because of the centralization of Alberta Health Services. Every time you put bureaucrats in charge who live in Edmonton or Calgary and never drive this province and see how vast the distances are between our communities, especially in rural north, I think they don't have an awareness of what it means when a hospital shuts down at 6 o'clock at night and you have to drive 2 hours to get to the next one. They don't understand the fear that would come from being a parent or a pregnant mom and worrying you're going to have a baby on the side of the road because the facility isn't open, or worrying that if your baby has a fever at night, there isn't a place to go to be able to get them the care. So we are trying to bring more local control and decision making back to each of the facilities operated either by Covenant or Alberta Health Services. In fact, in Lacrete, the hospital is being transferred in operating. It's going from AHS to Covenant Health as a request to the community. And I'm open to having those kinds of conversations if we cannot get the kind of service that is needed in the community, because I know how vitally important it is to be able to get good local care. And then if you need to have higher order either surgeries or testing, maybe you go to Grand Prairie, but then ultimately Edmonton is going to be the place where you're going to go for transplants and heart and NICU and some of the items that are hard to get anywhere outside of a major city. But you should be able to get most of what you need close to home. And that's what we're moving towards. It's part of the reason why we put such a focus on AHS improving that hospital care, because that is their core business. Surgeries and hospital care and emergency care is their core business, and we can make sure that we can deliver the rest of the care with more cost-effective means, with better operators in community, so that we can get our hospitals back to where they're supposed to be. That's the vision that we have. I don't know if you want to add anything there, Scott.
Thank you, Premier. I agree with everything you said. I think when you talk, it goes back to empowering the local regions as well, because we know what's best for our own kids and our own communities. And a lot of people, like to talk about the days when we used to have Dr. Payne, Dr. Cafaro, and not only did you have your choice of doctor, you had your choice of clinics in Slave Lake. So I always tell people, if you see a good idea that used to work, we don't all have to be Rhodes Scholars. Let's just revert back to what used to work and just continue to try doing it again. But the recruitment and retention of healthcare workers, doctors, and RNs specifically is a challenge here. We have a state-of-the-art hospital in High Prairie. They can't deliver babies. There's cancer treatments that could be done here. They can't use their helipad. There's just little common sense things that seem so fixable that I know frustrate so many people in this room in our area, because people are a group of doers up here. I've heard you say this once, that what you love about Northern Alberta is when we ask for permission and no one comes calling and we just go ahead and do it ourselves. I think that speaks very true of what we're like up here. But what we're finding is that we're people making decisions, like you said, 200 kilometers away, that have never driven around our lakes, never driven Highway 88, and just don't understand the incredible vast landscape we have. Our regional health authority is like the size of Texas, so we're included in Grand Prairie and Cold Lakes, and I mean, that couldn't be farther away. I don't think I've ever been to Cold Lake, to be honest with you, and I know Grand Prairie is vastly different than us. So people are hoping that we can get back to being, where we can still have a shared area where we can take care of hopefully the people in High Prairie and Slave Lake, but the people in Grand Prairie, have their completely different challenges than we do, and lumping them in with us is going to be difficult. But I know one thing specifically that I've been working on, that it's coming up at the end of the month, but I'm advocating for a couple members from High Prairie and area, and a couple members from Slave Lake and area to be on this new regional health board. So I'm pretty confident we'll get one from each at least, and hopefully more. That's a positive update. The other thing is I'm very excited about our the Enoch Surgical Center that's going to be opening in 2025, and where we can do some of these specialized surgeries. And I don't want to speak on the specifics, but just to summarize, as far as I understand, that if AHS can't deliver some of these surgeries, like hip surgeries, my own dad is barely moving around, and he's waiting another year, he was told the day before yesterday. So this is just unacceptable that people have to go to different countries for these. And if AHS can't provide them, we should be in a position where we can offer them an alternative that makes sense. And I look forward to seeing how that works out, and hopefully we can have some version of that smaller scaled in our region, whether it be High Prairie or Slave Lake or both. I would love to see it where you could do dialysis in Slave Lake or cancer treatments. But the fact that we can't deliver babies in our own town is nonsensical. And I like to finish with, whenever I'm talking about Highway 88, I always say a life in Northern Alberta is worth the same as it is in Calgary. Thank you.
So true.